Good evening, everyone, and welcome to Let's Talk Fibroids with She is Lotus. This evening, we'll be discussing fibroids with Abby and Sonia, and after they have finished their presentations, we will open the floor for questions. We are also being live streamed on Facebook, so if you're joining us on Facebook, welcome, 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 and I hope that this evening's session is informative, enlightening, and that we are able to help you in some way. So to start our sessions, we are going to start with Mrs. Abby Begho. Abby will be doing our first presentation. She holds a Bachelor's of Science in Medical Biochemistry from the University of Birmingham, an MSc in Clinical Biochemistry with Molecular Biology from the University of Surrey, and a Master's in Public Health from King's College. She started working in the pharmaceutical industry, but later transitioned to becoming a scientific program manager at the National Cancer Research Institute, based at Cancer Research UK. And then after the project came to an end, Abby worked for Ovarian Cancer Action as a healthcare project manager. She has acted as a consultant for charities such as Paul's Cancer Support Center, and returned to Cancer Research UK to work on the Health Professional Engagement Facilitator program. Currently, she is the director of program management at Lake Health and Wellbeing in St. Kitts and Nevis, where she manages all of their projects and the day-to-day running of the small non-governmental organization. We welcome Abby as she talks to us about fibroids.
Okay, wonderful. Thank you so much, Adelia, for that warm introduction. Very much appreciated. So I'm just going to share my screen. So just let me know if you can see my screen. Can you see my screen? Okay, great.
Yes, I can see the screen.
Okay, great. So let me... Okay, great. So thank you, everybody. It's great to see so many people here today. So like Adelia said, my name is Abby Begho, and I am the Director of Program Management at Lake Health and Wellbeing. So what I'm going to do is I'm going to talk to you guys a little bit about fibroids and also some lessons learned from a project that we conducted here in St. Kitts and Nevis. So just a disclaimer that I'm not a doctor. So I'm just going to give a very simple, brief overview of fibroids, hopefully touching on some of the important aspects of fibroids. So I won't be able to answer very clinical questions because as I said, I'm not a medical doctor. So what I'm going to start off doing is I'm going to talk to you a little bit about who we are at Lake Health and Wellbeing. As I said, I'll give you a brief overview of fibroids and then talk to you about the lessons that we learned from a recent project that we conducted, and then finish up with some conclusions. So Lake Health and Wellbeing, very briefly. So we are a nonprofit based in St. Kitts and Nevis. We focus on improving the health and well-being of our local, regional, and online community. And we do this through campaigns, through events, through public health interventions, through research, and a range of different other activities. And one of the areas that we focus on, or have been focusing on, is on fibroids. And we've been working on fibroids for a couple of years now, and really trying to understand some of the challenges that women with fibroids experience and what we can do to sort of address some of those challenges. So I'm going to get right into the overview of fibroids. So for those of you that may not necessarily be familiar with fibroids, I hope that this overview will be helpful. So fibroids are benign, also non-cancerous tumors that develop in or on the surface of the womb. So you can see in this diagram here, fibroids can develop all around the womb in various different locations. So fibroids have a number of names. So sometimes you may hear them being called as myomas, fibromas, and they can vary in size. So they can be very small, so small as a pea, and they can grow to develop to be as large as a melon. So in terms of the causes of fibroids, it's still very unclear what exactly causes fibroids, but research is ongoing to try and understand what are some of the causes, specific causes of fibroids. But we do know that the cause could be a combination of genetic and lifestyle factors. And we also know that the hormones estrogen and progesterone play some sort of role in the development of fibroids, and specifically they stimulate the growth of fibroids. So in terms of some facts and figures, fibroids are very common in women. It's estimated that 30 to 70% of women will develop fibroids before the age of 50. And most patients are in their 30s or 40s when they're diagnosed. Fibroids, generally speaking, are not life-threatening, but they can be painful and they can cause some very uncomfortable symptoms. So we do know that there are a number of factors that increase a woman's risk of developing fibroids, and they are as follows. So women of childbearing age, so i.e. age 25 to 45, are increased risk of developing fibroids. Ethnicity, so Black women have an increased risk of developing fibroids. If you're overweight or obese, you have an increased risk of developing fibroids. If you have a family history of fibroids, so if your mother, your sister, so close relatives have fibroids, then you're also at a slightly increased risk of developing fibroids. Consumption of red meat has been linked to an increased risk of developing fibroids. Also, consuming alcohol is linked to fibroids, and high blood pressure as well. If you have high blood pressure, that increases your risk of developing fibroids. And vitamin D deficiency is also related to an increased risk in developing fibroids. So if we step back, because like what I said was ethnicity is a risk factor for fibroids. It's actually quite a strong risk factor for fibroids. So if you take a step back now and look at Black women and fibroids, what we do know is that about 80% of Black women will develop fibroids before the age of 50. Black women tend to develop more aggressive fibroids, i.e. they develop fibroids maybe that grow quite quickly, but also may develop quite severe symptoms. We're also more likely to develop multiple fibroids, and we're more likely to develop larger fibroids, and we're more likely to develop fibroids at a younger age. So fibroids, we do have a different experience to our white counterparts when it comes to fibroids. So when we think about the symptoms of fibroids, there are quite a few, and as you may guess, some of them are related to our menstrual health. So heavy periods is a symptom of fibroids, prolonged periods, painful periods, bloating, passing urine more frequently, constipation, anemia, pain during sex, fertility challenges, and problems during pregnancy. These are all symptoms that are associated with fibroids. So if you or anyone you know are having any of these kind of symptoms, particularly the menstrual symptoms, so if you're having heavy periods, prolonged periods, and painful periods, then it's recommended that you do go and visit your gynecologist just to make sure that everything is okay and maybe see if you may have fibroids. In terms of the diagnosis of fibroids, there are ways that fibroids can be diagnosed. Your doctor may do a pelvic examination to sort of take a feel as to feeling around your sort of womb area to see if they can determine whether you may have fibroids. Ultrasound scan may be done to really get a view of what's happening inside and whether you may have fibroids, or they may do a hysteroscopy, which is where a telescope is inserted into the vagina and they can have a look around and see if you may have fibroids. Or alternatively, they may do laparoscopy, and this is where a telescope is passed through an incision in the abdomen. And again, they take a look around and try and see if they can visualize and determine whether you may or may not have fibroids. So in terms of treatment, treatment can be divided into 4. So for women that maybe have fibroids, but have no symptoms whatsoever, everything seems fine, your doctor may say, okay, let's just monitor you. So they may do what some people call watchful waiting. So they'll monitor you regularly to kind of see, is the fibroids growing? Are you developing new fibroids? What are your symptoms like? And just really try and see if the fibroids are progressing, and if so, how fast are they progressing? And so if you are in this category, the suggestion is that you just keep a note of what's happening. Make sure that your doctor is giving you that information so that you know how fast your fibroids are growing, how big they are, and also keep a note of your symptoms. And one of the things that you can do, which I'll come to, is kind of look at your lifestyle as well. If you're under watchful waiting and you're not receiving treatment, is that you can actually think about your diet, exercise, and really changing your lifestyle to see if you can try and manage any of the symptoms, or also try and just see if you can sort of keep the fibroids at bay. So one of the things that's really important, as well as if you're overweight, one of the things would be to try and see if you can try and reduce your weight and maintain a healthy weight. And that could possibly help in terms of managing the fibroids if you're under this category of watchful waiting. Another treatment option is medication. So medication can be used really just to treat some of the symptoms. So if you're having pain, if you're having heavy menstrual bleeding, you may be given some medication to try and manage those symptoms, but also you may be given medication sort of temporarily to see if they could reduce the fibroids. Medication, generally speaking, is not going to cure the fibroids, but it's really used to manage your symptoms. Then you may have some procedures, so things like a myomectomy, where it's a surgical procedure where you're removing the fibroids, but the uterus remains intact. You may have something called embolization, which is where they sort of cut off the blood supply to the fibroids and sort of try and starve them, so to prevent them from developing. And then a hysterectomy, which is the removal of your uterus. Then the fourth bucket is sort of complementary and alternative therapies. So these are sort of options that can be explored if you are looking for more sort of natural ways to manage your symptoms. So you can look at dietary changes, exercise, and various different things like breathing exercises to see if you can manage your pain. But these are things to just manage your symptoms. They may not necessarily cure your fibroids, but they will help in terms of managing your symptoms. Now, when we think about fibroids prevention, which is really where we want to get to, we want to prevent more women from developing fibroids, because as we know, prevention is better than cure. So we have to again look at our lifestyle changes that we can make. So exercise, we know that exercise really can help in terms of preventing or reducing our risk of developing fibroids. So keeping active, doing as much exercise as we can. A healthy diet, so trying to eat a very healthy diet, lots of fruits and vegetables, cutting down all of the processed foods and things like that really can go somewhere to reducing your risk of developing fibroids. Again, as I mentioned previously, maintaining a healthy weight is also good in terms of fibroids prevention, and also making sure you get enough vitamin D. Reducing your red meat consumption, eating more green vegetables, those have been found to be associated with a reduction in risk of developing fibroids, and reducing your alcohol consumption, and finally maintaining a healthy blood pressure. So these are some of the things that we can all do to try and reduce our risk of developing fibroids, but also other health conditions as well. So now I'm going to transition. So that was a sort of a summary and overview of fibroids. And so now what I'm going to do is transition into some work that we did in 2020 to understand the experience of women in St. Kitts and Nevis who are living with fibroids. So I'm going to just give you a brief overview and then just share with you some lessons that we've learned from this research project, which you may or may not be able to apply in terms of your life. So the aims of this project, it was to understand women's experiences of fibroids, and we were looking at it purely from the patient point of view. We wanted to understand what were women feeling, thinking, and seeing and feeling in terms of their fibroids experience. And we wanted to try and understand what are the challenges that women with fibroids are experiencing that may impact their health and well-being. And we wanted to do this so that we could identify any support needs so that we could address those needs. So we did an in-depth exploration of 11 women's experiences. So we looked at 11 women from St. Kitts and Nevis, and they were aged 23 to 49, and their average age was 39. And we did one-to-one interviews where we did really sort of delve deeply into their experience in totality. The interviews are transcribed, we prepared transcripts, and we analyzed those transcripts, and we prepared a report. So in summary, what we found was that fibroids impacted every aspect of a woman's life. So physical health, so as I was mentioning before, women explained that they were experiencing severe pain when it came to their fibroids, heavy menstrual bleeding, anemia. Women also talked about having fertility issues, so fertility, pregnancy complications, postnatal depression, and difficulties conceiving. And then there was quite a lot of issues around mental health. There's sort of a lot of fear and anxiety and distress associated with fibroids, whether it was just concern about the future, concern about things like the symptoms and what those symptoms might mean, and just concern about relationships. There was a lot of mental health kind of challenges associated with fibroids that maybe a lot of us don't appreciate. Also personal and social life, fibroids had a significant disruptive effect on women's daily activities, affected their relationship, affected their work life. So it affected all aspects of women's life. It affected women's professional life. So, we had absences from work, low productivity because some of the symptoms, so the painful symptoms, women really not able to focus at work, tensions in the workplace because of lack of empathy. And in some cases, women lost their jobs for various different reasons associated with their fibroids experience. And then and also embarrassing occurrences at work. So whether women were having bleeding accidents at work and things like that. And all of that just made the professional lives really difficult and very challenging. And then of course, there's the finances associated with managing fibroids. And that's things like the cost of care, the cost of medication, which over the long term, cost of medication may be cheap one-off, but over the long term, those kind of costs really do add up. And then the cost of buying large quantities of pads and menstrual products. So all of these things affected women's finances as well. So as I said, fibroids affected every aspect of a woman's life. So, I mean, what we concluded from our research was that fibroids are challenging both mentally and physically, and we believe it requires more attention so that women can get the support that they need. So in terms of the lessons that we've learned along the way as a result of our research projects, I'm just going to summarize like a few of these lessons. So what we were able to pull out was that really the key part of a woman having a smooth sort of experience when it comes to fibroids was a good doctor-patient relationship. And what we found was that women that had good doctor-patient relationship, it sort of enabled them to have a more effective and allowed them to more effectively and pleasantly navigate their way through their experience and also make informed decisions because their doctor was really kind of empowering, empathetic, they could ask questions. And so that doctor-patient relationship was really key in terms of setting the tone for the kind of experience that women would have with their fibroids. We also learned that the power of social connection was very important. So we found that women felt happier, empowered when they were connected with other women with fibroids so that they could share experiences and learn from each other. But they also felt happier and empowered when they were connected with informed and empathetic family and friends. And I think the key thing is for family and friends to be informed and to also be empathetic and sympathetic. And then also trusted and empathetic healthcare professionals. Because sometimes I guess healthcare professionals can be a little bit abrupt, but we found where healthcare professionals were empathetic, really sympathetic, that really also helped. And so all of these kind of help, that kind of social connection and women having that sort of social circle of people that supported them was really powerful. We also found that, women being empowered and informed to take control of their health was very important. So women being empowered with holistic self-care techniques and effective self-management techniques was also very helpful. So women knowing like what to eat, what not to eat, what medication to take, how to take care of their mental health, all of that really helped in terms of improving women's experiences with fibroids. And I also, not only will this be applicable to fibroids, but also other kind of health conditions as well. We also learned that really there needs to be a focus on mental health. And I think for gynecological conditions like fibroids, like endometriosis, and like PCOS, I think sometimes we can forget the mental health component. But what we found was that fibroids can be mentally draining and women do need the support in terms of navigating all the challenges that they may encounter when they do have fibroids. And these, like I said before, because fibroids affect every aspect of a woman's life, then women are going to need holistic support. They're going to need the support that's really going to empower them. So whether that's the mental health, which will be the mental health support, but also financial support, which will also then help them in terms of their mental health. Another key thing that we found is that menstrual health education is really important. What we found was that there was a general lack of awareness of what good menstrual health period should look and feel like. So how, generally speaking, I guess women weren't aware that, their period shouldn't be very painful or overly painful. It should be uncomfortable, but not overly painful. And so women were suffering with a wide range of symptoms, not realizing, or menstrual symptoms, not realizing that these were abnormal and living with these symptoms for years and years before actually getting any help. And so what we think it's really important that we get some menstrual health education out to young girls, out to women as well, so that we can all be really aware of what a normal period looks and feels like. Also, we also found that there was a lot of lack of empathy and sensitivity around menstrual health issues. And, you know, people not really understanding or not wanting to understand some of the challenges that women may experience as they navigate sort of going through a range of different menstrual health challenges. So we really feel that there needs to be more sympathetic and empathetic and empowering dialogue about menstrual health and women's health in public discourse, in the workplace, and all along the healthcare pathway. So at times it feels like menstrual health issues are trivialized, and really this doesn't help because women are experiencing a number of challenges and not getting the understanding that they need and the support that they need. So we do feel that there needs to be a lot more empathy around menstrual health. Also, another issue that came up with asymptomatic fibroids. So there are women that will be living with fibroids where they have, you know, no symptoms at the present time. But what we do know is that long-term asymptomatic fibroids can become medically significant. So there is a need for women to have really good care, even though then they have asymptomatic fibroids. So these fibroids need to be monitored regularly. We need to be checking whether these fibroids are growing, are they multiplying, and what's happening. So we just need a little bit more care around asymptomatic fibroids. And then finally, we need to address all the barriers to women receiving a prompt diagnosis. So like I was saying before, because a lot of times women may not be aware of what a normal period looks and feels like, there may be some delays in being diagnosed because women aren't realizing that there is something wrong. And so we have patient-related barriers, which is the help-seeking barriers and not realizing that something is wrong. And other issues may stop women from going to get help if they have any menstrual health symptoms. So we need to really ensure that patients are educated, empowered, and there's some advocacy to ensure that women are diagnosed promptly. But we also need to address some of the health system barriers as well. So generally speaking, what we are suggesting is that we need a more focus on patient-centered care and the diagnostic process, regardless of where a woman seeks help, whether a woman seeks help with her general practitioner, at the emergency department, in a clinic, or with a gynecologist, wherever a woman seeks help. That process of being diagnosed needs to be as efficient as possible as well. So just to conclude, conclusion, fibroids is a significant health issue that affects every aspect of a woman's life. We do believe it requires more attention. Right now, you know, it doesn't necessarily feature heavily in sort of the public health strategy of a lot of ministries of health. So we do feel like it needs to be seen as more of a priority, along with other issues like endometriosis and PCOS. And we believe that if this is done, women would be more empowered, there'll be more information readily accessible, and also more support to manage women that are living with fibroids. And overall, we just think there needs to be a bit of a cultural shift, with there being more sensitivity and empathy across the board when it comes to women's health issues. So I'd just like to finish off with some acknowledgements. So I would just, in terms of our research project, I would just like to thank all the women that took part in our research project, Dr. Fanta Waterman, who was our research advisor, Natasha Atkins, who was our funder, all our research assistants who helped in terms of analyzing the data, and also like to thank the staff at the Innovation Hub at the National ICT Center who were very accommodating, and the Ministry of Health for all their support with this work in terms of giving us ethics approval, etc. So again, thank you so much for your attention, and I hope you found this information useful. Thank you.
Thank you so very much, Abby. That was very informative. So if you have any questions, you can start placing them in the chat. And after we have our next presentation, we'll start taking questions. So at this time, I'd like to introduce Mrs. Sonia Boddie Thompson, who is a fibroid survivor and a diplomat. She currently serves as the counselor at the Permanent Mission of St. Kitts and Nevis to the Organization of American States in Washington, D.C., USA. She is married to a Vincentian and has no children, and is a youth and woman empowerment advocate. She enjoys public speaking, traveling, meeting new people, and reading. Welcome, Sonia.
Thank you, Adelia. Good evening to all. And I just want to say a special thank you to Adelia for inviting me to be a part of this very important conversation. I think it's a conversation that should be had more frequently. And I'm absolutely delighted to be here to share what I consider my fibroid story. So I was diagnosed with fibroids about maybe a little under 9 years ago. Prior to that, I had experienced a lot of extreme pain during my menstrual cycle. I recall when I was about age 18, I started having those really bad pains, and my grandmother at that time, visited another elderly lady in our community and to get some of that special old people bush, as we would call it. And interestingly, the bush did not work. So then we started going to the emergency room. And, for old people, if they have these bush and they boil it, they would think, that should solve all the problems. But then we realized that my pains were so extreme that the bush was not helping. So that's where my frequent visits to the emergency room started. That was about age 18, thereabout. I later traveled to Mexico for university, and even while there, I experienced quite a lot of menstrual cramps, and there were occasions where I actually had to visit the emergency room as well to get, medication to relieve the intense pain. As time went on, and I was then studying in the UK, I recall on one occasion while I was having my menstrual cycle, I vomited a lot. It was a lot of vomit. I was actually at another doctor's office waiting to be seen, and I just started vomiting so much that they actually had to call in the ambulance. And after, we got to the hospital and they did their assessment, the doctor just said, you're just 1 in 100,000 people who have a really, really bad periods. But, it continued, and a year or two later, having returned to St. Kitts, another doctor then diagnosed me with, initially, one doctor said that I had primary dysmenorrhea, which is, I'm just one of those persons who have really, really, really bad symptoms when I have my menstrual cycle. So I'll get the bad periods, I'll get the vomiting and all of that. And my visits to the emergency room would necessary to actually alleviate me of the pain, relieve me of all that agony that I suffered from. And then about a year later, another doctor diagnosed me with seedling fibroids. So that's where it all began in terms of having a diagnosis. But as was explained by Abby earlier, a lot of times when you're initially diagnosed, a doctor will tell you that they're pretty small, they're seedlings, and most doctors would not want to operate on you when you have seedling fibroids. And that is understandable for the sense that, doctors will tell you they really only want to have a surgical intervention if it's absolutely necessary, because there are complications that can happen with any type of surgery. So I've known that I had fibroids for about 9 years. But again, I would monitor them. I would go to the doctor every year to do my annual checkups, and the doctor would say, they're still pretty small. So knowing that I had fibroids, they were there, and it was not advised that I should take them out at that time, but I was still experiencing so much frustration, literal pain. I mean, I was frequenting the emergency room like every month, because just taking oral medication was not doing it. I had to get injections. I had to get IV. I literally lived, I would tell people, I lived on a cocktail of drugs. Voltaren for the pain, coupled with tramadol at times. Then it was necessary to have gravel for the vomiting. And that carried on for quite some time, for many, many years. But in recent years, what I've found is that I started feeling worse. So beyond, just having bad stomach ache or having bad back aches, I started having pains in the right side of my head and in my right leg as well, which was very different. So I started having not only back pain, I had stomach pains, I had pains in the right side of my head, the right side of my leg, and I was vomiting a lot nearly every time I had my period. I literally, every month, I literally knew that, okay, I have to go to the emergency room. And it was a very difficult, very, very, very difficult experience. And I could recall there was one occasion I was screaming so much. I was just screaming. The pain was so immense. And my godmother said, remember, sometimes you come on television. And I was like, the people on television cannot feel my pain, because, at that time, my job allowed me to be on the television from time to time. And for me, at that point, it didn't matter who saw me or heard that I was screaming. I was just in so much pain. I didn't know how to just express the pain I was feeling, because generally, you know, doctors would ask you on a scale of 1 to 10, how much is the pain? And for me, it was like 12, 13, 14. It was really, really, really bad. And one thing I would say to women is that a lot of times we comfort ourselves thinking, okay, our period is just going to last for 3 to 5 days, and then you're going to go back, you know, you're going to be fine again. And, you know, I think a lot of times we fool ourselves thinking that, because now, you know, when I look back at, you know, how many years I actually suffered from, you know, these really bad period pains, I sometimes wonder if I should have probably had a surgery before. I actually just removed 16 fibroids on June 20th. So it's just been 5 weeks since I had 16 fibroids removed from my little body. And I know earlier Abby mentioned that weight and obesity is one of those risk factors for fibroids, but I'm really a slim person, so I did not fall in that category. And very often my stomach didn't look very high. So again, it's something that would make you feel like, okay, it's fine, you're good, you know, don't worry too much about it. But in reality, the fibroids were really doing a number inside of my body. And a lot of times we don't see it externally, but inside there's a lot of disruption that's happening on the inside. I would say though that in terms of the risk factors, one, I'm a Black woman, so I guess that I fall into that category, and that's, we are in one of the higher categories of persons who are predisposed to getting fibroids. And also my mother had fibroids back in the day, and she had a hysterectomy. One might ask what prompted me to eventually remove my fibroids. In recent months, beyond the pain and the frustration, I started literally feeling like I had big melons in my stomach. It became like really difficult, especially around my menstrual cycle. I would feel like my stomach just felt like I could feel like big balls or big melons all over my stomach. It was just a very weird experience. So there's the pain, there's the agony, the frustration, and then I also had my menstrual cycle. I started bleeding very, very heavy. I started changing my pads very, very often. I started having longer cycles and then more frequent cycles. And I also started experiencing a lot of blood clots. So I was experiencing the pain, the blood clots. I started feeling very weak. And then the doctor said I was suffering from anemia. And then these fibroids, they were just, you know, my stomach felt really, really, really compromised. And so I decided to visit a gynecologist, who then referred me to a fertility specialist, who then referred me to a gynecological oncologist. And we did several ultrasounds. And even when they did the ultrasounds, they felt like, you know, they didn't get a good view of what was happening. So I needed to have MRIs done. And then when we actually had the MRI actually showed that there were 15 fibroids. And interestingly, when they had the surgery, they actually found 16 fibroids. And one of the fibroids that they didn't detect on the MRI was actually 6 centimeters, and it was an intracavitary fibroid. It was actually within the cavity of my uterus. So it's a very challenging situation, because even the best equipment sometimes do not see everything, because people feel like, hey, an MRI is even better than an ultrasound. But had they not gone in, they would not have seen that one. It was, you know, and it was actually in a very difficult position. The surgeon actually told me, he said, we are surprised you weren't experiencing even more pains because of where that fibroid was. They also informed me as well that my uterus was distorted to the size of a 16-week pregnant woman. So the fibroids, even though on the outside very often I didn't have a very bloated stomach many times, on the inside, the fibroids were really distorting my inside and really creating a challenge for me, and creating a lot of discomfort, especially in the last 2 months. I remember I called in sick from work. I just felt really bad. I just literally could not work. I could not work for like 2 days. It was terrible. And then even the week before my surgery, again, I had my menstrual cycle, and I was calling the surgeon's office. I was like ready for them to just come and just remove everything in that body, because it was just so painful. It was just really, really, really painful, really uncomfortable. I was bleeding quite heavy. They were like heavy blood clots, and it was really concerning. And for me, having discussed it with a friend, she said, you definitely need a better quality of life. And very often we tend to be very private when it comes to these types of situations. But I think sharing is definitely caring, because had I not shared what I was experiencing with another friend who actually had been through a similar experience, I would not feel as motivated to really step forward and probably visit the doctors and get second and third opinions and actually make a decision to have the surgery. Because a lot of times as humans, we are fearful of surgery. Somebody's gonna put you to sleep, they're gonna open your inside, you don't know what is going to happen, and you're just worried, you're scared. But when you have somebody else who's encouraging you, providing you that support, who's been through the experience, who can walk you through it and who can give you guidance in terms of the recovery procedures, etc., you're in a much better place. So that's why I think we definitely need to have these conversations more often, and just to be our sisters and brothers, and just be a support to each other. Because a lot of times we feel like these conversations are only for women, but not necessarily. I believe that men need to be a part of these conversations as well, so they can fully understand what we as women, what we are actually experiencing. And I'm extremely thankful to my husband, who has been a great support to me, because post-surgery, it was a very difficult experience. Obviously I will not be able to do a lot of things, and he was really on hand to be my day and night midday nurse, and to assist me and to understand what I was going through. And even before you actually have your surgery, a lot of times you're in let's say a workplace, and you might say that, oh, you have your cycle and you're not feeling well. And people say, oh, a lot of people take it for granted that because when you have fibroids, for some people, your menstrual cycle is just not a menstrual cycle. It's just a very frustrating, stressful, difficult period. And you're not like everybody else. You're just going through a very difficult time. And I could recall, for example, there was a time at work, I heard my boss speaking to me, and I'm hearing the information, but I'm just not able to process the information, because it's just like, you just do not have the necessary focus, because fibroids, it tends to drain you, it wears you down, it makes you very fatigued, it just takes away from you having a very good quality of life. And sometimes we speak about absences from work. I was one of those persons that literally nearly every month I had to take a day off or 2 days off. And when you think of productivity, that does not look good on your work record, but it's just what you are actually facing. I've had situations where I've traveled for work and I've had to leave a meeting. I've had to go to the emergency room because I just was unable to cope. The stress of the fibroids, in my body really created a very difficult situation. So I would say to anyone, if you have fibroids and you really are not performing at your optimum level, it's very often you feel like you're not your true self. You just don't have the energy, or you feel really ill. And as Abby mentioned earlier, having really painful periods is really not normal. It's definitely something that you should get checked out and get a second opinion and get it addressed. So I'll stop here for now, and I'll address any questions after. Thank you.
Thank you so much, Sonia, for being open and sharing your story with us. So at this time, we will open the floor for questions. If you are comfortable, you can raise your virtual hand on Zoom, and then I will acknowledge you. You'll unmute and ask your question, or you can place the question in the chat. This is both for those who are on Facebook and for those who are on Zoom. And I already see a few questions here in the Zoom chat. And the first question is from Shanika Bascom. Good evening, everyone. If the fibroids are about grapefruit size, would you advise women who do not have children to do a myomectomy? I can start. As a woman who does not have children, I had a myomectomy in 2017 because of the symptoms of the fibroids. I was having heavy bleeding. I was having to take more and more pain medication just to feel any kind of relief. You talked about, Abby, the challenge of having your clothes messed up at work, at church, just going out because of the heavy bleeding, and they needed to come out. So I personally had a myomectomy as a woman without children in 2017, and they removed 5 fibroids. One was about a grapefruit size, and that helped me for a little bit. Sonia would have recently, just a few weeks ago, had her myomectomy as well, and she doesn't have children as well. If your fibroids are affecting your quality of life, you are losing out on productivity at work. It's affecting your relationships. It's affecting how you feel about yourself. It's affecting your mental health. It's something to discuss with your doctor, and you weigh the pros and cons for your own situation and see what is best for you. Sonia and Abby, what would you say to that person?
The question was about if the fibroids is as small as maybe like a
grapefruit.
Well, I think on the scale, grapefruit size is definitely, initially I thought it was grape, but grapefruit, definitely I think with a grapefruit, that would put it anywhere about maybe 5 centimeters or more. And I think generally the rule of thumb is once a fibroid reaches anywhere about 5 centimeters, it's definitely time to have them, removed, because they're not going to get any smaller, and the larger they get, they're going to start creating challenges on the inside for you, pressing against other vital organs and all of that. And it's depending on where they are situated, you're going to definitely start feeling some level of discomfort. It's more than likely that you'll start feeling discomfort. Yeah, grapefruit, definitely. I will encourage anyone to really have that conversation with their doctor and have it removed.
Yeah, so I don't really have too much more to add, except to say that, you should really have a really good conversation with your doctor, and really your treatment plan should be basically developed around you and what your situation is. So how are your symptoms really bad? Are they significant? And all of those questions, but also your intentions in terms of starting a family. So would you like to start a family in the future? And so therefore, if you would like to, then you need to think about fertility sparing surgery, which is the myomectomy, but there might be other options. So definitely have a good conversation with your doctor, talk to them about your symptoms, how intense your symptoms are, and then what your intentions are for your family. And then you can develop a program or treatment program and strategy around what your needs are, and specifically to your needs. So that's my 2 cents.
Okay, Sonia, thank you, ladies. This next question is for you. Was your surgery done in St. Vincent?
No, I'm actually based in the US right now. So my surgery was done here in the US.
Okay, and there is a comment here. Removing fibroids is one thing, but a hysterectomy is different.
That is certainly true, because when you have a myomectomy, and the word it's called myomectomy, the removal of fibroids is referred to as a myomectomy because fibroids are usually known as myomas or leiomyomas. So the removal of fibroids is referred to as a myomectomy, whereas with a hysterectomy, you're actually removing your entire uterus and with a hysterectomy, you're no longer able to have a child yourself. You're no longer able to actually have children naturally. So definitely for me, that was not under consideration. Again, I'm 38. I do not have any children as yet. So for me, certainly a myomectomy was my first option. And I would like to add that, in conversation with your doctors, because I've visited several gynecologists over the years, and some doctors would be hesitant about doing the fibroid removal. Again, because with every surgery, there are possible complications. Anything can go wrong. And one of the biggest challenges with a myomectomy, from what most doctors have said to me, is the possibility of you losing a lot of blood. There is that possibility. And if during surgery, when they're removing fibroids, you run the risk of losing a lot of blood in your life. You know, your life ends up being in danger. What they would tend to do is to quickly remove the entire uterus to probably save your life. So that is why most doctors would hesitate or be reluctant to actually remove fibroids when they're really small, and they'll be more keen to remove them when they're creating a major challenge for you. I recently listened to another fibroids discussion with another doctor, and another gynecologist, and what she was saying as well is that a lot of times when you have fibroid seedlings, they're so small that even during surgery, a lot of times the doctors actually are unable to remove all of them because they're so small. After that surgery, a few years later, those little seedlings start growing, and then they may have to then operate on you another time, have another surgical intervention. And you'd really want to minimize the number of times that you actually have surgical interventions, because there are things like, you know, scar tissues that could then create other complications for you, etc. And then and another thing is, once you've had, in most situations, once you've had a myomectomy, if you're going to have a child after, then it's highly recommended in most situations that you have a cesarean section, meaning that the doctors are going to have to cut you again to remove the baby. So then you run the risk of having a lot of cuts, and with that, again, there are, you know, always possible complications. So again, you know, the discussion is about your quality of life and how much your fibroids are really affecting you and your ability to function effectively and productively as a human being, and what your other aspirations are. Because again, if you have fibroids that are growing really large in your stomach and then you become pregnant, a lot of times, you know, you'd often hear the conversation that the fibroids are competing with the baby for space and all of that. So there are other levels of, you know, complications that can arise if you maintain those fibroids inside and allow them to grow very large. A lot of times too, we hear that, you know, fibroids are usually found in women of childbearing age. And, you know, I was listening to a discussion recently, they were saying that it's like an old wives' tale, that a lot of times women who experience a lot more challenges with the fibroids are those who are yet to have children, because, you know, your uterus is saying, well, hey, what's going on down here? The babies are growing. So the fibroids themselves start growing so much, because you would find sometimes in the earlier stages, they're not growing as much, but as you know, you get older, they start growing at a much more accelerated pace.
Okay, thank you. And we have 2 hands, then we'll go back to the comment section. iPad, your hand was up first, so go ahead.
Good evening, everyone.
Good evening.
Ms. Thompson.
Hi.
Ms. Thompson, it's good to see you. You're looking well. And thank you for your bold explanation of what happened to you. I had fibroids many moons ago, and I had them removed. It was about 6 of them. There was one large one, large like the palm of my hand, and anybody who knows me, I'm very tall, and so the palm of my hand is long. So there was one long one, it was white with red veins. So you could see that the fibroids was actually taking substance. Blood was feeding off the substance from my body, and there were like 4 or 5 smaller ones. I did not fit into the category that Abby gave, because I always had heavy periods and painful periods, but that was it. And it's when I went to school in Barbados, I went to the gynecologist just for a checkup. And he is the one who told me that I had fibroids. The doctor here never told me you would go to the doctor because the period was painful, but they never said anything. And then when I was leaving 3 years later, I went back just to get a final checkup. And I remembered his expression. And it was like, oh my God, you have to get these out. They're large, they're huge, you know. But unlike you, Miss Thompson, I couldn't do it in Barbados because the insurance said it was a common surgery that could be done in St. Kitts. So they were not going to pay for me to have it done in Barbados. So I had to wait until I came home for the summer to have the surgery done. But they came back. I actually have fibroids again. But because I'm in menopause, the doctor is hoping that they would shrink. so that I don't have to go and do the surgery. So, and another thing you mentioned, Miss Thompson, is the blood loss. When you're having the surgery, the doctors are very, very scared about there being blood loss. But what I had done, and I got the idea from my doctor in Barbados, when I came home, I told the doctor I wanted to give my own blood. I didn't want anybody's blood. So he did the calculation that I could be allowed to give the blood, and then he did the calculation when my blood would build back up, and then I'll be strong enough to go and have the surgery done. Thank God they didn't have to use the blood. So those of you who are planning on having surgeries and all of that, maybe an option is to ask the doctor to allow you to give your own blood, right? But other than the heavy periods, I didn't have like a big stomach or anything. I didn't go through like what Miss Thompson would have gone through, but everybody's body is different. But I would admonish all of us as women to visit your doctor regularly. And if one doctor don't tell you what you want, or you think that something is wrong and this doctor telling you something, and you know the pain you're feeling is so severe, it can't be this, you go and you go doctor until you find somebody who finds what the problem is. Sometimes we stick with one doctor and he's not helping us. And because I remember telling my gynecologist, you're a man, you only know what the book tells you or what people come in here and tell you. You don't know how I am feeling. And they really don't, unless they are a woman who experience what you're experiencing, they don't know. So you find that you go to the doctor until you get the diagnosis that is required. And we must talk. Sometimes we are too secretive with things, and that there are people who can help us. If you open up, as Miss Thompson said, she spoke to somebody who she didn't even know had gone through the same thing. And the person was there as a mentor to hold her hand and guide her through this whole process. So Abby, I thank you and all the others for having this session, because I open up all of us, our experiences are different, but we can learn from them. So thank you everybody for this session.
Thank you, thank you.
So could I just really quickly pick up on a point that Sister
Yes,
Diana
Abby.
made there? So the point that I would like to make is really about understanding, which I said in my presentation, what a normal period looks and feels like. So if you're having heavy menstrual bleeding, if you're having painful periods, and these are and the pain is so intense that it stops you from doing your daily activities, then please do go and see a doctor or a gynecologist so that they can check you out and make sure that there isn't an underlying issue. I think a lot of us sort of assume, and I think that's one of the kind of myths, that, you know, periods should be painful, they should be, you know, we should be experiencing this kind of uncomfortable, painful sort of periods, and, you know, we should be lying down, you know, I mean, it's fatigue associated with it. But if your periods are really difficult, please do visit your doctor. You should not be suffering terribly with your periods. Periods may be uncomfortable, but they shouldn't be excruciatingly painful. So please do visit your doctor. Another point I'd like to pick up on is speaking to people. A lot of women are suffering in silence, and really that is affecting our mental health. And we do really need to speak up about these things. And if you're really struggling, you know, speak to a mental health professional, speak to a counselor, speak to your doctor, and see if you can get some support. Because like I was saying, fibroids can be really mentally draining. You know, it affects every aspect of a woman's life, and it can become very overwhelming. And so there is nothing wrong with you reaching out to get some support in any way possible that you need, so that you can really manage and really live a full and fulfilling life as well. So thank you.
Thank you, Abby.
I just wanted to piggyback on something that Abby said. She's right. Definitely, we need to have more conversations. Because a week after I had my surgery, I made a post on Facebook, and that's actually how I got to know Adelia. The truth is, today's the first time I'm actually seeing Adelia. I made a post on Facebook pretty much just outlining my experience and that I had the surgery. And so many persons, you know, left comments on my page, and people reached out to me personally. And there were so many people that I knew, that I've known for so many years through work, church, just being a regular human on this planet, being a esthetician, that eventually reached out to me privately and shared that they had that they had fibroids or they had miscarriages because of fibroids. And, you know, and I was just amazed, and I was like, wow, imagine if we have more conversations, more women who are at home, just, you know, feeling down, feeling depressed, uncertain as to what to do because they don't know what the outcome might look like. If we have more conversations, more women can then probably take the next steps that are necessary to improve their quality of life. So I think that's really, really, really important.
Yes, thank you. Next, we'll take Amanda, and then we'll go to a Facebook question, and then we'll come back to the Zoom questions. So Amanda? Amanda Richards?
Good night,
Okay.
everyone.
Good night.
Good night.
Good night.
Yes, I just wanna share something, you know, and hopefully I could get, you know, a little advice. Since around, say, when I had my last child in 2010, you know, I used to feel this lump right just above my stomach on the left side. And I used to always think, oh, it was the baby kicking, because I keep feeling this movement. But when I went in to have the baby, they said, I just saw the nurse just touch, and she said that right there you have a fibroid, right? So I'm wondering, like, how the fibroid would be up unless the fibroid is sitting on your womb. So when your womb goes back down, it goes down with it, right? I'm wondering about that part. But my thing is that every time I go to the doctor, they will tell me I'm anemic. I am tired of doing blood tests, and they will say I am anemic. Well, I recently moved to a new state, so I'm with a GP, and I went to do some 3 times now. They sent me again up here to do. I moved from the Caribbean to the UK. They sent me to do blood tests again. All them come back, and I am anemic. I suffer from very heavy periods, bloating. I did ultrasound. They said I have multiple fibroids, and a myomectomy would not work. And like the ablation, whatever they call it, it would not work because of the amount of fibroid and the location. And how it is in this country, I've been on a waiting list since November to see another gynecologist. I called recently, but I am still on waiting list because it's very hectic to get, you know, to see a GP in this country. I guess it have to do with the COVID and all of that. But for the anemia, Ms. Thompson, like, what do you do? How can you help to build up your blood? You know, after losing all this blood every month, I will have to change a pad like on the hour, every hour for the first 3 days. You know, at night I will use what they call adult pampers, or something you call them, those things that you use, adult pampers, I guess. You know, I use them at night times just to save my sheets and my mattress. So in terms of having low blood, how can I help to build up my blood every month? Because they keep giving me like iron and stuff like that, but like the iron is not helping, the blood is not staying up, it's just going down all the time. I'm not feeling myself at all. Every month the same problem. I could never say I am feeling well in my body. I bloat in my stomach a lot. Yes, but I don't get pain, just the heavy menstrual flow, and that associate with the multiple fibroids. So I want to know like how I can build up my blood like every month while I'm on this waiting list, because I am contemplating about the surgery too. I believe they might tell me to do it, but I'm kind of scared.
Okay. Sorry, I didn't get which country you said you were in?
In the UK.
Oh, okay. Well, what the doctors prescribed for me when I was diagnosed with anemia early this year is a medication called Vitamin C, because iron is best absorbed when you're also taking vitamin C. So it's a medication called Vitamin C. And for me, that has worked quite well. But I will also encourage you to eat foods that are actually rich in iron as well. And I do pray and hope that, you know, you get bumped up on that waiting list as soon as possible. I don't know if you can consider moving to a different area in the UK just to try, but not to move like full time, but try seeing whether or not you can get to see a gynecologist in another area of the UK if you still have such challenges. I know I wanted to mention something, touch on something that was mentioned by the previous person that spoke in terms of fibroids and menopause. And that's one thing I've found doing my readings, and a lot of doctors have shared that as well, that they have found once women start going through menopause, the fibroids start shrinking significantly. So again, fibroids is really something that really affects a lot of women who are in childbearing age. But so that is why a lot of persons would tell you, if they're not interested in having children, or if they've had their children, or a person would say, hey, I'm just gonna have a hysterectomy. I'm just gonna get over all this drama, this stress, this fatigue, this pain. But again, it boils down to everybody's individual situation. And for me, my biggest advice would be definitely just speak to a gynecologist. And if you're not content or satisfied with what one gynecologist has told you, and especially when you're having surgery, I always believe it's good to have a second opinion.
Yeah.
Yes. And something else I wanted to add, she mentioned about where fibroids can be located. And I think we should talk about that a little bit. There are three main areas where fibroids can be found. So we have the intramural fibroids, which is the most common one, and that's the one found in the muscle of your uterus. Then we have the subserosal fibroids, which are found on the outer uterine wall, and they grow into your pelvic area. So maybe that's one that you would have had with the baby that's growing on the wall of the uterus and pushing into your pelvis. And then we have the submucosal fibroids. Okay, thank you, Abby. Here we have a visual. So as you can see, the intramural fibroids are within the wall of your uterus. And then we have the subserosal fibroids, which are the ones that are growing out on the outside of the uterine wall and grows into your pelvis. And then we have the submucosal fibroids, which grow just under the surface of the uterine lining, and they grow into your uterine cavity. So Sonia talked about the 16th fibroid that wasn't showing up on her ultrasound or her MRI, but they found it in her uterine cavity. That would have been a submucosal fibroid. And then we have what we call pedunculated subserosal or pedunculated submucosal fibroids, which have a little stalk like a thin piece of tissue that is attached to your uterus, and it either grows on the outside of your uterus or in the uterine cavity where a baby would normally be.
Okay.
So depending on where your fibroids are located, they can pose complications as well for the surgery, for treatment, and the types of symptoms that you're going to experience.
Okay.
Yeah.
So it's always important for you to know, and I always tell women, when you go to the doctor, ask for copies of your tests. Ask them to explain what are on your results so that you know where your fibroids are, how many fibroids you have, what sizes they are, and what does this size mean for me, so that you are a part of your treatment. You know what is happening to your body, in your body, and when doctors give you options for treatment, you're able to say, I'm not comfortable with that. Let me go think about it or talk to somebody else or something. Always know what's happening with your body. So I just wanted to add that because it's important.
Let me just add.
Let me also, sorry, go ahead.
Go ahead, Abby.
Yeah, I was just going to just like a practical matter in terms of the lady's question, in terms of the UK and the waiting list. So in the UK, the waiting list can be very, very long, which is the downside of the healthcare system. So one of the things that you could try and do is to keep checking back in, because say, for example, they have a cancellation or something like that, then maybe you might be able to get in sooner. The other option, which obviously you may not want to do, is that you may have to try and go private, which means you have to pay. And that way you definitely get seen sooner as well. But if there's also another gynecologist in your catchment area-ish, maybe in your surrounding area, you could maybe reach out to your GP and ask if your GP can refer you to maybe another gynecologist who might be in a close kind of countdown area, so that you can actually get referred to them if their waiting list isn't as long. So those are just some practical matters on maybe how you could kind of get in to have your surgery a bit sooner, because the waiting list can be, the waiting time can be very, very long.
Yeah, thank you very much.
Okay, thank
Adelia,
you.
Sorry. I just wanted to add to what you were saying. So you outlined the different types of fibroids. I had all the different types of fibroids. I had them in every angle. I had them inside the uterine cavity. I had them in the wall of the uterine cavity. I had the pedunculated ones. In the 16, there were 16 variations, and they range in sizes from 1.7 centimeters to almost 9 centimeters. So I had, I think I had the full package. And I said that to say, because you mentioned that depending on where the fibroid are located, they present different symptoms and different complications. I've had friends who've had babies and had their fibroids removed at the same time. And in my little head, I had hoped that whenever that time the Lord wishes to bless me with a child, that I could spare myself having to go under the knife on 2 occasions by, hopefully having my child and then having the fibroids removed at that time. But after the doctors did the MRIs and the ultrasounds and the MRI, they recognized there is no way you should get pregnant with this number of fibroids in the places that they're actually located. You'll be definitely putting yourself at a very, very, very huge risk. So again, it's very important that we discuss location, size, the number, and the implications. Those are things that really need to be considered. And again, as you said, because I've been to another gynecologist who said to me, okay, this is your situation. I'm not telling you whether or not you should have a surgery. And when you're paying somebody and you think that they are the learned, trained professional in that particular area, you're going to them seeking guidance, and you think that they're the competent authority to tell you X or Y, and they tell you, well, the decision is yours. Again, a lot of times because they themselves don't want to do something that might be too risky, and then there's a terrible outcome. So again, it's always good to seek second and third opinions, because even though I'm in the US, as I said, for me, every year I like to get my teeth cleaned at the beginning of the year and go and see a gynecologist and get my annual checkup. And so when I moved to the US, at the end of December, and I went to see a gynecologist at the end of January. And she then referred me. She was like, after she recognized my case, she was like, although I'm a gynecologist, I think I should refer you to a fertility specialist. Gone to a fertility specialist. She then said, hey, I don't think I'm the best person to see you. I'm referring you now to a gynecological oncologist who's even more specialized. So sometimes we have to go through different people to really get the outcome that you desire and to really feel satisfied that what you're going to do is the best option. And that is totally okay. But once we are actually doing the necessary to improve our quality of life and to make our situation better, I think that is the most important thing.
Thank you. And Tiandra, we're coming to you, but there is a question on Facebook. She's asking, is there any scientific evidence of persons successfully shrinking fibroids? I will be going on a 30-day program for women that can help to shrink fibroids. I hope that I will get great results. Abby, you can join in here, but I will just say from just personal experience and from others' experience that I've heard and read about, there are persons who have successfully shrunk fibroids naturally. I'm assuming you're talking here naturally, through diet and exercise. And there are medical ways of shrinking fibroids as well, if you do not want to do full-on surgery. Medical ways would include uterine artery embolization. That's where they inject agents into the artery supplying the uterus, and that is in an effort to cut off the blood flow to the fibroids, and in that way you can shrink your fibroids. So there are both medical and natural ways of shrinking fibroids, and always remember, everybody's body is different. So what may work for me may not work for Sonia, and it may not work for Abby, and it may not work for you. So even if this program is not successful for you, there are other things that you can try if you're trying to avoid having actual surgery. But there are options out there. Abby?
Okay, great. So in terms of the scientific evidence, so I could refer, there is a paper that I have read recently about complementary and alternative options in terms of trying to manage fibroids and fibroid symptoms. So when it comes to natural methods, it's a challenge. So a lot of the times it depends on the size of your fibroids. If you have a really large fibroids, it's really going to be difficult to really try and control and shrink those fibroids naturally. You may be able to do a little bit of shrinkage and a little bit of managing the symptoms. But if your fibroids are slightly smaller, it might be easier to kind of deal with. But some of the things that research paper showed was that women who tried things like diet and exercise, they did show an improvement in their symptoms. Women who tried things like acupuncture, things like various different herbs, although they didn't give the specific herbs, some of those things also helped in terms of managing their symptoms and possibly shrinking their fibroids. I think we do need a lot more research in terms of natural ways of managing fibroids and trying to shrink fibroids. Yes, but it is a challenge. It is a challenge because I know women are looking for natural options to manage their fibroids. But basically, if you can look at options to where you're looking at your lifestyle, so reducing your weight, looking at your diet, exercise, and just also engaging with your doctor as well, because there are a lot of doctors who are actually open to thinking about natural and alternative ways to manage your symptoms and also shrinking your fibroids. I think you need to get very good advice as well in terms of those natural options, because there's so much information out there. A lot of it hasn't been vetted. So you need to get really good advice. And I guess one of the things that we're going to be working on in the I guess the future, when we're able to start doing some work around it, is to try and really put together some list of evidence-based ways of naturally managing your fibroids and your fibroid symptoms. I think there is information out there, but you do have to just be careful the source of the information and make sure that it's accurate and reliable. But just try, like Odelia said, you know, everybody is different. So you can, again, you can try the lifestyle changes and you can try maybe seeing somebody who is an expert in sort of natural medicine, but also, you know, you have to be careful about who you go to.
Thank you, Abby. Tiandra, we'll take your question.
Hi, good night.
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 Night, everyone. Good night, Mrs. Thompson, my dear
night.
friend. Well, it wasn't really a question. It was a brief, you know, sharing my experience, because I would have had a hysterectomy done in 2019. And prior to that, fibroids affected my life, as Abby said, just about every single area, from relationships to work and so forth. And I didn't have anyone to share it with. I didn't have anyone. Fibroid is not a topic that comes up in casual conversation, right? So I relied on the internet, on Google, read on it. And I remember I'm a very physical person. I like to go to the gym. I have to work. I love working out. And there was a point that I just could not work out anymore. The more I work out, the more I noticed the bulge in my stomach. And it got to the point where I got depressed, because it affected even my mood swings. I got depressed. I was constantly in and out of depression. I had low blood pressure as well. And I exhibit fibroids after my 3 children, because I have 3 children. So I saw someone was asking if you can get fibroids after having children. In my experience, that will be a yes, because I had all 3 of my children before I was diagnosed with having fibroids. And someone also mentioned about being afraid of taking the surgery. A few months before I took my surgery, I started to share with ladies at the gym, and they said, look, do not be afraid. We did it, and to find out that is what 3 or 4 persons that I knew for a while would have done it. So I bravely took the opportunity and took the chance and say, you know what, let me get, because it felt like a foreign body in my own. And I remember not even wanting to leave the house because I didn't like how the way I looked in my clothes, because I had this big bulge almost. I looked at least 6 months pregnant at some point. So it was the best decision to take the surgery. I had 2 doctors. I was seeing one before, and then I was referred to another. And after my surgery, I had to take out one of my ovaries, sadly, because they were so huge that they started to affect one of my ovaries. But it was the best decision I took. I feel healthy. I getting myself back together. Well, I could say I'm back together. I'm 80%. And so don't be afraid. As Miss Thompson and Abby and everyone have been saying, check your doctors, make sure you see as many doctors as is necessary for you to feel comfortable. And you won't regret it, I hope. Everyone is different, but me personally, I don't regret the decision of taking the surgery. I feel so relieved. I would not be able to bear any more children, not that I want to, but I'm okay with that. I'm okay with that because the benefits, the health benefits that I have now, I do appreciate that. Thank you.
Thank you so much for sharing. Okay, I'm going to the comment section because those comments would have come in before the 2 raised hands I see, so I'll come back to you. But in the comment section, someone was asking about what you did to prevent your blood from dropping low, and you would have mentioned that already. The medication that you took, iron and vitamin C and iron-rich foods, which would include things like spinach and broccoli, chickpeas, pumpkin seeds, dark leafy green vegetables, kidney beans, etc. So foods rich in iron, iron supplements with vitamin C. Okay, Abby, maybe you can help us with this question. What are some myths related to fibroids that are important for us to know about?
So I think that some of the myths would be, well, I guess the first thing is a lot of people just say, oh, if I have fibroids, I can't have babies. I won't be able to get pregnant. So I think that's a common one that I hear a lot. And it's not necessarily so. It depends on the location of the fibroids. It depends on the size of the fibroids as well. I mean, some women may have some difficulties conceiving and difficulties getting pregnant. But with some careful sort of management, they may still be able to have children. So like I said, it depends on where the fibroid is located and the size of the fibroid. So that is one common myth. Other myths that we hear about tend to be related to sort of the menstrual health symptoms, so the heavy menstrual bleeding and the pain. And so people saying things like, ooh, you're unclean because you're having this heavy menstrual bleeding and these kind of things. And sorry about that. Sorry, my phone rang. So these kind of things, and those are myths. You're not unclean. You're not unhygienic. There's nothing like that. So that's another myth that sometimes we hear. I think there's just a lot of misunderstanding when it comes to family members and friends as well. So family members and friends may not understand the amount of pain. They may just think, oh, it's just fibroids. That's no big deal. So I think there also needs to be education amongst family and friends to understand that fibroids can be very painful. They can be very uncomfortable. They can make women feel very fatigued. So I think that kind of myth that fibroids are just no, they're no issue. They're just very benign and there's nothing, there's no real issue with them, needs to be busted, because that way, if we can sort of educate family and friends about fibroids, then I think those things can be addressed. Another myth that comes up is, oh, fibroids are cancerous, which is not the case. Very very, 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 very rare, if at all. So that's a myth as well. What else? Another myth is that, I have to have a hysterectomy to treat my fibroids. And that's not the case. I mean, there are other options that you can explore in terms of managing and treating your fibroids, depending on your own personal situation. Another myth that we sometimes hear is that, women who are teenagers and women in their 20s can't get fibroids. And of course, that's also not the case as well. We know of cases where women have had fibroids in their late teens or early 20s. So that's another myth that we need to sort of address. I think that's probably about the myths that I've kind of come up with, I think. Oh, and then of course the myth of, I have to stay at home. If I have my period, I shouldn't go anywhere. I shouldn't do anything. I need to just sit at home and keep out of society. I've heard that quite a lot. And of course, you don't have to do that. You can still go out there if you have your period. You can still go out there and interact and do things and exercise. It just depends on you and your energy levels as well. But obviously, if your period itself and its symptoms are stopping you from doing those things, then you need to go and see the doctor. So I think those are some of the myths that I have come across in terms of the research.
Yes, thank you, Abby. Diamond is asking, are cysts on the ovaries and fibroids connected? They're both gynecological conditions. That's their connection. You can have both. So main causes of cysts on the ovaries: endometriosis, hormonal imbalance, pelvic infections. They're both gynecological conditions. You can have both at the same time. And again, highly strongly recommended, please see your doctor if you have cysts on the ovaries and fibroids, or even just one condition, and get the help that you need. This next question is for Mrs. Thompson. From your experience in going to gynecologists in Mexico, was the treatment plan or approach different when you visited gynecologists who are Black women or have had more Black patients?
Interestingly, I've only ever been to, I think, one Black gynecologist, one Black female gynecologist, to be honest. I've only ever been, most of the gynecologists I've actually visited have been men. And at the time I was in Mexico, I was not diagnosed with fibroids as yet. How different was the experience at that time? Because I was just complaining for menstrual cramps. A lot of time I was just given what do you call it, diclofenac, which is Voltaren. That's the name for it in Spanish, diclofenac. They would just give you Voltaren. And for me, in the earlier stages, Voltaren was my go-to. I remember my mother was very concerned that I might get addicted to Voltaren because I felt like I needed to have Voltaren. And Voltaren really provided a lot of relief for me initially. But in the last few years, I needed a Voltaren injection to actually feel that difference. It worked a lot faster. So I really can't speak to, because it's only since I came to the US, I visited a Black female gynecologist, and it was very short-lived because she then referred me to a different specialist.
Okay, thank you for sharing. Corinne Archibald.
Hi, good evening.
Good
I don't have a question per se. Hi, Sonia.
Hi, Corinne.
My thing is that I am so happy for the organizers of this conversation, because what I've realized is that there used to be, growing up, a stigma on just talking about fibroids. I know, for instance, one time there was someone who had a surgery, like a hysterectomy, and they were like, don't tell nobody I had this surgery. It was, and I think society looked at them like, oh, she took out her womb and can't get no more children and that kind of thing. And so I think as we grow and technology, it have opened up more for women to talk about it and to share with others. Because I remember one time my class group, we had, as we're older now, we have had discussions about it. We've had a doctor who gave us a lecture on it. And I think women become more comfortable talking about it and knowing what to look for, the symptoms and all of those. I myself, I am a sufferer. I did until I hit 50. So I never did anything. I was recommended surgery, which I got scared. I got cold feet. I always said, I'm going to do it. Friends who have done it recommended it, but I was just too scared. I never did it. And now menopausal and not, no surgery in sight for me, hoping they'll shrink, as everybody say. But I've heard one doctor who told me when I visited that that's a myth, that they do shrink. So I'm hoping it's not a myth and they would shrink. But I'm happy for this conversation. When I saw it, I was like, I have to tune in, because I'm a sufferer. I did suffer heavy, oh my God, clots. You're in the bathroom and they're just falling out and those kind of stuff. Oh my God, 2 of those purple pads. And you're wondering when you sit down and get up, what's gonna happen? Oh my God, yeah, I'm happy for this. And it's a good conversation to just inform those who might not know. And I hope you could have a part 2, or maybe, invite younger people to it so that they themselves could get the symptoms. And what's funny enough, I think I might have had it at a young age because, like in high school, I remember having bad cramps and, people saying, oh, that's the norm. You have period, pain and stuff like that. But as you get older and then you realize, you wonder, I might have had them even younger, like some little pea size or something like that. So that too would need to, encourage our young people to listen to these conversations, have their own input and experience about it. And thanks, ladies, for this.
You're welcome.
Sharing, Karine. Okay, I'm going to Facebook. There's a comment there that I'm concerned for the person. She says that she's been bedridden for almost 3 weeks because of her fibroids. They are as huge as a full-term baby. She's lost a lot of weight and she is slightly immobile and her blood is low. I am encouraging you to please seek medical attention immediately. That's all. Please get help immediately. This is not something to put off. This is something you need to do now. And that's my encouragement to you.
I completely agree with that. I second that. I think you definitely need to get medical help. Do not stay at home and suffer like that.
Yeah.
If you need to call 999, I encourage you to do that and maybe go to the emergency room and really try and get some help, because maybe they might have a gynecologist in the emergency room, or they can refer you to a gynecologist. So I definitely think second what Odelia just said.
Please.
I totally agree.
Yeah.
Yeah. Fibroids should not put you in that position. That's when, definitely you need immediate intervention.
Yes. Okay, the next question is for you, Sonia. You mentioned that you had surgery 5 weeks ago. What is your post-surgery recovery experience? Also, did you have an open myomectomy or a laparoscopic myomectomy?
Me, I wish I had sorry, what's the word? The
laparoscopic.
The laparoscopic. That was that was my dream. That was my ambition. That was my hope. But regrettably, because of the number of fibroids I had, and because of the fact that my uterus was so, when I looked at the report, it says irregularly distorted at the size of a 16-week pregnant woman. So my uterus was not in any normal fashion whatsoever to have the sexy route of having the laparoscopic route. Most persons would get the bikini cut. I did not even have that luxury of the bikini cut. So my cut runs from my navel, just below my navel, going right down. And again, those are the type of things that sometimes put off women from actually considering surgery, because it's like, oh, you're gonna mess up my body, I can't wear bikini. Initially, up until I had my surgery, I thought that I would be having the bikini cut. But when I woke up and the doctors explained to me, they said, when they did their final assessment, they recognized, nope, my uterus was so distorted that they needed to cut me in the other direction to ensure that, you know, I had a very safe procedure. Post-surgery recovery, the first few weeks were very difficult, And what I tell people, it was not so much the pain, the incision pain, like the pain, the cut, that didn't hurt as much. What my biggest challenge was gas pains. Oh my gosh, I thought gas pains were going to take me out. Gas pains, I drank so much ginger tea after ginger tea. And you know, when those pains hit you, they're like crippling pain. So for me, the gas pain, and then I remember I had to like call the office. I'm like, I'm drinking ginger tea. It's not working. So I had to get Gas-X. There's some medication, some oral medication called Gas-X. Sometimes, you know, they will encourage you generally after a myomectomy to walk. They said walking helps with, you know, assisting with gas, because you see, many persons that I've spoken to now since I've had my surgery, they're like, yeah, the gas pains is normal. And I speak to several doctors like, yeah, because I had never heard that in my life. I never knew that this gas pains post-surgery was a thing. In my head, I was thinking, you know, the pain from the incision was going to be my biggest challenge, but that really was not a challenge for me, the gas pains. And when those gas pains hit you, I would be like calling out to my mother, like, Chanel, you know, literally. And a lot of times I found when those gas pains hurt the worst was when my body wanted to do a number. So anytime my body was preparing to do a number, that sudden sharp gas pain would just come across my pelvic area. And that was difficult, like extremely painful. But thankfully with, you know, increasing walking, so I tried to walk around the apartment and taking Gas-X and drinking lots of ginger tea, that helped a lot. Another concern after surgery for me as well was, it took me like 5 days post-surgery to actually have a bowel movement. And that was pretty concerning, because I know in some hospitals, they would not let you go out of the hospital until you've had a bowel movement. I had my surgery on a Monday. I came out of the hospital, I think I came out of the hospital on a Thursday, because 2 days post-surgery, I vomited a bit. And so they were, you know, they kept me a little longer for observation. But I was getting worried, and they themselves, they were like, I was getting worried, and they were like, oh, it could take up to a week for you to have a bowel movement. And I'm like, really? And I was getting worried, and I remember, you know, I contacted them, because this is the Friday and still nothing, but the gas pains hitting you and you're not able to have a bowel movement. And they were like, okay, well, buy a milk of magnesia. So I started taking milk of magnesia. Nothing happened 6 hours later. And I'm like, okay, but I take some more milk of magnesia. You know, it was actually like a massive celebration in my apartment, but I had my first. It sounds hilarious. But when you have that bowel movement after you've had surgery, it gives you a sense of relief that, you know, okay, all those things in your body actually still working fine. They didn't interrupt any, you know, mechanical functioning in there. You're good to go. So that was a big celebration for me. And, you know, even passing gas the first time after surgery was like a big win, because every minute the nurses would ask you, have you passed any gas? And you're like, no. And, you know, there's like, you need to walk more. And, you know, the first time that happened, I was like, yes, that's the gas. It sounds hilarious, but it shows that, you know, in complications of life, there are little wins that might seem so simple to somebody else, but for your health, it makes a big difference. So as I said, for me, the biggest challenge really was gas pains, and I'm pretty much past that now. I'm into like my 5th week now since I've had my surgery. I had that a lot, maybe in the first 4 weeks, but now I have it very rarely, and it's not as bad. It's very rare and it's not as bad.
Thank you for sharing. The next question is about the complications of shrinking the fibroids the medical way. So that would be the uterine artery embolization. With any surgery, with any medical that you do, even with the medications that we take, there are always side effects, there are always complications to be aware of. Complications can occur if the blood supply to your ovaries or other organs is compromised. but the risk to doing the uterine artery embolization is similar to actually doing the myomectomy. So you just have to weigh which one you want to do and what would work best for you. Again, have a conversation with your doctor. They'll best be able to guide you to what is best for your situation. Tashana, you wanted to say something? Okay, I guess not. Do fibroids shrink after you have given birth? We just heard from somebody who just said no.
Okay.
Go ahead,
Well, yeah, just generally speaking, I think there was a research study that showed that during pregnancy, fibroids can grow because of all the hormones and everything. And then after pregnancy, in some women, the fibroids did shrink because, again, the hormones are going down. So it's possible. It's possible.
Okay. Some more questions in the Facebook chat. What about doctors? Any recommendations? Carissa, can you let us know what country you are in first? And then we might be able to give you some guidance. The same young lady who talked about being on in bed for the last 3 weeks, she has commented again. She said she went to the hospital and was told to make an appointment, and there's a long waiting list to get the surgery done. So she is on a waiting list. I'm not sure what country you are in, Yolanda. If you can let us know, maybe we can give you some guidance and support. And then somebody else commented about the gas pains, Sonia, post-surgery. She said her biggest pain was when she wanted to cough or sneeze. She felt that someone was ripping out her stomach. Okay. Okay, Tashana is asking, okay, she's asking, why have surgery if there are easier options? Why have surgery? Again, it depends on where your fibroids are, the size of your fibroids, and how it's affecting your body. So there are always things to take into consideration. Where your fibroids are, size of the fibroids, how it's affecting you. So yes, there are easier options like shrinking the fibroids, but then if you take Sonia's example, that was not an option for her based on the size, and it's a good thing they went in to find the other one, the one that was hiding.
Yeah, because that was 6 centimeters.
Yeah, that's a large one, and where it is, that's problems. Yeah. So again, what treatment option you choose will depend on your personal situation. Okay. Yolanda, or you went to the hospital. Okay, you're in St. Vincent, and it's a long way. So you had an appointment at the hospital outpatient clinic with a gynecologist, and somebody is sharing that in Anguilla, if anybody else is in Anguilla, they are sharing that they did their surgery at Hughes Medical and they had an awesome experience. So if you're in Anguilla, that's an option. Someone else is sharing that they did their surgery in St. Vincent at the Annesville Medical Center, which is a private hospital with Dr. John Barker. So that's an option as well. Then you have, of course, the hospital services, which is public. There would be a waiting list. There are other gynecologists who operate privately, like Dr. Damaris Batiste. You have Dr. John Barker. There are other doctors, if you're in St. Vincent, who do operate privately if you're able to take that route. If not, and you have an appointment, okay, someone else is sharing that they did their surgery in St. Vincent at Annesville Medical Center with Dr. Vergara. So that is private as well. And then in the hospital services, which should be public, there are gynecological clinics where you can see the gynecologist and they can give you an appointment for surgery. I'm not sure how long the waiting list there is. Okay, someone, again, Sonia, and your bowel movements and your gas pains. Someone else is commenting that She recalled her nurse ensuring that she had a bowel movement prior to discharge, and she had hers the day after surgery, which certainly made her gaspings easier. You certainly started a conversation about gaspings.
You had quite some luck. I wish I had that luck, because no, those gaspings,
it took you out.
They were ready to take this young girl's life.
Okay, if anybody else has any questions, now is the time, because we have gone through all of our questions on Zoom and in our Facebook chat. So if you have any more questions, let us know now, as we are coming to an end. I don't want to miss anybody's questions, and it's something important that they need to know. So if you have any more questions at this time, we'll take them. You can raise your hand, post it back in the chat on Zoom and on Facebook. If not, we will bring this evening's session to a close. And I just want to thank Sonia and Abby for accepting my invitation, in being here tonight, and in having this session. I really appreciate it. It has been very informative. We have started a conversation that I hope we can continue, because when it comes to women's health, there's always something to talk about. And I remember when I first started talking about it, people would tell me, you shouldn't really talk about it, you know, it's periods and nobody needs to know, and don't talk about it. But I am always thankful for my friends and family. They were always like, somebody else out there is like you, and they need to know that they're not alone. And that's why I persisted, because too often as women, especially as Black women, we are cast as the superwoman, the strong woman, who take all the pain, who suffer, and you suffer with a smile on your face, and you suffer silently, and you don't let anybody know your business. And we just sit in silence, and we are struggling, and we are crying on the inside, but we are so scared to let people know, because we are afraid of the judgment that may come with opening up. But I want women to be encouraged that it's okay. It's okay to share. You may not want to do it on such a public forum, but you can share with your friends, you can share with your family, because somebody else needs to know that they're not alone. They need to be supported and encouraged and directed to the right resources for them. And that's why we do this, and that's why we will continue to do this, because you are not alone. There's nothing wrong with you. You didn't cause this to yourself. This is nature, this is medicine, and you don't have to live with suffering. Help is available. An analogy I like to give is that as women, we are the CEOs of our lives. Your life is a business. Abby, I'm sure you've heard me say this before. I always preach it. Your body is a business. Treat it like a business. You are the CEO, the founder, and the owner. You go to a medical doctor, medical practitioner, a nurse, whoever, and they are not treating you well, they are not offering you the help that you need, you can fire them and hire new people. Because if you had a literal business and employees and they were not working, you'll give them a warning and then you'll fire them if nothing changes. This is your body. It's expensive. It's valuable. It's worthy. So treat your body like it's important, and I say like a business that you're running. And if persons are not treating your body with the same care and respect, whether that's a medical professional, a friend, or a family member, then you need to fire them. And you hire people who are going to be an asset to your business. You hire people who are going to help you take care of you. And that's my encouragement. So I hand over to Abby and Sonia for their parting words. Abby will take you first.
Okay, wonderful. Well, first of all, I'd just like to say thank you so much to you, Odelia, for organizing this really informative session. I think it's great to have forums like this where people can share their experiences and learn from one another. So definitely appreciate this session and appreciate all the work that you're doing really to support women living with fibroids and other gynecological conditions. Thank you to Sonia. I'm just saying my own thank you to Sonia. It's really nice to hear your story. And thank you so much for your bravery in terms of sharing and being so open. So I think in terms of my parting words, I would just like to say, I guess, two things really. One is, and I've said it throughout, I guess, throughout the session today, is that fibroids can be draining. Living with fibroids can be very draining. If you need the support, I would encourage you to reach out. Don't be afraid, don't be ashamed. I just encourage you to really reach out and to get the support that you need. The second thing I'd like to say as well is, which is what I think both Sonia and Odelia have been saying, if you're not happy with the care that you're receiving, always reach out and try and get a second opinion so that you can get the support that you need and get the medical care that you need and that you're comfortable with. It does make a difference, like I was saying in my presentation, to have a doctor that you feel very comfortable with and that you feel kind of understands what you're going through. So really, I think it is important to try and find that doctor that you'll feel comfortable with, because it really does make a difference. I think as well, it's good for us as, well, I'm not a mother, but if you're a mother, to also share as much information as you can with your daughters about what good menstrual health is. What is a normal period? What symptoms do they have in terms of, do they have heavy menstrual bleeding? Do they have painful periods? And try and get to it early so that they don't have to suffer in silence and they don't have to suffer unnecessarily with symptoms for a very long time. So really, I think it's for the next generation as well, for us to educate and empower them about their menstrual health so that they don't have to suffer in silence. And then I guess my final, words would be also, I guess we have to do some work around family members and friends, whether that's husbands, whoever is around us, the work, and also the workplace, so that we can create a more empathetic environment for women that are going through some of these issues. So I think as well, it's also for us, working in public health, to try and raise awareness of some of the challenges that women experience so that we can have a more empathetic society when we're dealing with some of these issues. So thank you.
Thank you. Thank you, Abby. Sonia?
Ladies, it's been an absolutely amazing evening. I just certainly want to thank you, Odelia, for putting this conversation together. It certainly has been a pleasure, having this conversation with you and Abby and all the other ladies. And I hope that there is at least one man. Well, I think my husband is tuned in, so to all the ladies and men who are tuned in, because again, a lot of times we have these conversations and we feel that these conversations are only for women because women are the ones who are affected by fibroids. It is important that this conversation be an inclusive conversation because we need the support of men for them to understand the challenges that we face and the support that we are going to need to overcome these challenges. For some of us, it may take us a much longer time before we actually have that intervention to have the fibroids shrinked or removed. And during that period, that waiting period, we will experience a lot of symptoms that would make us not perform at our best and to be our best selves. So we really need that support. I initially, when I shared that I had surgery, there were so many persons who were shocked. They were like, oh, Sonia, I can't believe you went to that. You actually shared that on Facebook. Like, there were people who were just shocked. They could not believe that I disclosed something that was so private. But, I always believe that there's always something that, my story is, I go through experiences so that others could benefit. And it's not that I want to overshare anything, but maybe if other persons had shared, I had been in a lot more conversations in the past, I might have had an intervention, a surgical intervention quite earlier. Probably, who knows, that can change. But knowing what I know now, since I've had my surgery, I've done so much reading about fibroids. You think I'm going to be taking it? My husband was like, you're going to take the fibroids exam? Because I look at so many videos, I read so much. And I just think that the Lord allowed me to have this experience so that I could, it could serve as a testimony to somebody else who just needs to hear that you are not alone. You're not the only person that's going through it. There are options. This is what somebody else went through. And hey, there's a sister out there who you can speak to. And that's how Adelia and I connected. I didn't know Adelia from Adam's Tree, but when she saw my story on Facebook, she sent a message saying, my fellow warrior. And I was like, oh, great, there's this person, but I don't know her. And, we connected. So I think sharing is really important. And, as has been expressed earlier, if you are having really bad periods, heavy periods, if you're changing pads too often, definitely have that conversation with your gynecologist. And if they're not recommending an ultrasound, ask them to do an ultrasound. I know, again, one of the challenges for a lot of women is finances, and ultrasounds and MRIs, they are very expensive. I know they are expensive, but I hope that we do not allow, finances to prevent us from having the best quality of life that we could have if we get the right help. And I really pray and hope that our sisters who have shared that they are on waiting lists, that they get bumped up soon. As Abby said, continue calling just to find out if somebody has canceled, ask them to put you on that waiting list, that, in case list, because, getting the required attention is important. And if there's anybody who wants to reach out to me directly, feel free to do so. I like sharing with people because people have shared with me, and a lot of persons have poured into me, and I believe I've become the person I am because other persons have assisted me along life's journey, and I'm here to assist anyone else who just would want to have that conversation. So again, thank you to everyone who tuned in. Thank you, Adelia. Thank you, Abby. Thank you for all those who shared their experiences, who asked questions. It's been an absolute delight, and I'm available for future conversations.
Okay, thank you so much, everyone. Remember to take care of yourself, mind, body, and soul. You can find Sonia on Facebook. She is always sharing about fibroids.
Well, before you close, Adelia, thanks to Adelia, I found out that this month is actually Fibroids Awareness
Month
in the US and in several other countries, and the color for Fibroids Awareness is white.
Yeah.
And again, that's something that I didn't even know. So I'm happy that Adelia connected with me, and I'm learning so much more about fibroids.
Yeah, so let me also jump in actually real quick just to say that one of the things that we're hoping to do is in St. Kitts and Nevis, it is just about timing and really getting the funding to do so, is to actually do a lot more work in terms of providing support to women in St. Kitts and Nevis who are living with fibroids. And also we do want to also advocate for July to be formally recognized by the Ministry of Health as Fibroids Awareness Month, just to give fibroids that greater priority and attention that it needs. So we're a bit slow, but we're slowly working on trying to develop a lot more kind of support services for women with fibroids. So please, if you're based in St. Kitts and Nevis, do look out for the work that we're doing. We're kind of moving slowly, but we're hoping that we'll get there eventually and in the end so that we can provide the support that you all need.
Excellent.
If you can see from Abby's background, you can find her at Lake Health and Wellbeing, both on Instagram and on Facebook. And if you're in St. Kitts, you can see her in person. And in St. Vincent, you can find us at she.is.lotus, she.is.lotus, both on Instagram and Facebook. Feel free to send us a message. You will either get myself or my partner, Kimet. We both run those pages, so one of us will answer you by the end of the day. So thank you again. Be on the lookout. The next awareness month is September, and it is Polycystic Ovarian Syndrome Awareness Month. So be on the lookout for that. The color, get your teal ready. So you have time to get something teal. That's the awareness color for September. So thank you again, everyone. We look forward to talking with you further and to have you at our other events. Have a blessed evening and have a wonderful rest of the week. Good night, everybody.
Bye.
Bye.
Bye. Good night, everyone.
Good night.
It's been a pleasure.
Bye.
Take care.
Thanks, ladies. Good night, everyone.
Bye.
Good
Thank you for
night.
being here.